Morning, everybody. I expect that everybody's sound connects. Thank you for joining us on a Monday morning. We're in. I think that's everybody in from the waiting room. So yes, welcome to this Sporting Heritage webinar, working towards the UK approach to memory activity. As you know, we've been building on these memory-themed sessions. And this work is stemmed out of our work that's been happening in Scotland. So the majority of this session is going to be led by Hugh, MacLennan and Michael White, who's leading on that. And we're very much interested in hearing your feedback. So it's going to be a mixture of presentation and discussion. For those of you who I don't already know, my name is Fran Stobbold and I'm the Workforce Development Lead for Sporting Heritage. So I look after the training sessions, the hangouts, the networks and conference when it comes back round again in October. We are recording today's session, so if you would prefer not to be recorded, you are more than welcome to turn your cameras off. Hugh and Michael, I don't know whether you want to do around the screen or whether you'd prefer people to introduce themselves in the chat. What would you rather do?
Well, I think it would probably save time, actually, if people just introduce themselves when they're coming on, because otherwise quite a lot of people, so it would take a while.
Lovely. So if you want to follow in Anita's footsteps and introduce yourself in the chat, I think there's a few people who know each other and a couple of new faces as well. A couple of people have said they're having poor sound. Is anybody else hearing that as well?
Yeah.
It's just on yours, Fran, at the moment.
Okay. Well, I'll mute myself. Maybe that's a good opportunity. I'm somewhere where I'm not normally zooming from, so I think on that note I'll hand over to yourselves, Hugh and Michael, and let you take over.
Okay, hopefully the sound issues will resolve themselves. If not, could you let us know, please? Could I just have a thumbs up that we've got that the first slide there? How about let me go back. How about let's see now. Okay, do we have the first slide there? You've got that, and you've got sound okay from my end? It seems to be anyway. Okay, excuse me. Good morning, everybody, and thanks for joining us. Hopefully everybody's managed to get their clock in the right place, and it is Monday morning, so no wonder we're having a few glitches. It's pretty stormy here in Scotland today, so it's more like the middle of November than middle of March. But we're going to make an assumption here that most of the people, as far as we can see, would not have been involved in some of our earlier meetings. So apologies if we're going over just a little bit of previous ground as we're going through. Michael and I are preparing a document for Sporting Heritage UK, which is a strategy document for the development of memory activity. And it's largely just because of our own experience. It's based on what has been happening in Scotland. And one of the purposes of today is to try and get a feel for some of the nuances which would apply, because obviously for political reasons, geographical reasons, and all sorts of other reasons, there are differences about the approaches which have been taken before and which may very well be taken in the future, and we'll refer to some of these, and largely they are to do with things like government provision of social care and so on, which is a very fluid situation for us here in Scotland, and we have the intervention of another election coming up in a few weeks, which could impact a lot on the way everything's managed, and that's not to mention COVID and all that, but we'll come to that as we go through. So to just the final paper will have a fair bit of background in it as to why we are where we are, how we got to where we are, why memories of sport are so important in the overall memories activity scene. We can't go past the impact of COVID because it's had a huge impact on us in Scotland, for example, where we had to almost overnight change our activities from face-to-face and involvement with care homes and all the rest of it into online activity, almost 100%. And that had quite a dramatic impact on the way we were delivering our activity. And there's a transition period to go through now as we come out of COVID, which is a challenge for everybody. And then there's the post-COVID, and then there's also the fear or the reality that we could be hit with something else at some time in the future. So that there have been some good learning experiences, obviously, but also massive challenges in terms of resources and delivery. The impact of the impact of dementia across the UK is a well-known and recognised now challenge for the medical and particularly the social care sector. And whilst there are challenges there are opportunities for us, which we'll outline today. So it'll be partly historical at the beginning, but then there will be the development aspects of taking us to where we are and where we want to go. So we will detail in the document how the various aspects of our memories activities in Scotland have been operating and how we see them developing in the future, the actual physical delivery of what we do, the timeframes, how long it takes. Michael and I are also at the moment finishing off handbook for delivery of memories groups, which will be ready. Stirling University are giving it a final run through this week, and we hope to have it prepared and ready for issuing in the next month. So that will sit side by side with this, but also it'll have to knit into the other strategy documents being prepared in other parts of Sporting Heritage UK as well. And these will involve all sorts of things like the practicalities, looking ahead to evaluation and research, because there are a number of research projects underway which we would like to dovetail with, and there's also the need for further research, which is crucial, particularly in terms of seeking further funding. So before COVID, we were very fortunate to be able to deal with our groups, whether they were in care homes, hospitals, or with individuals on a face-to-face basis. And what was becoming increasingly apparent in the last 18 months for us here was the, you can refer to it as potential for expansion, but also the pressure on demand was becoming a serious issue for us. And we needed to take a long, hard look at how we can get ourselves through that period, because it is simply a massive challenge, given our almost total reliance on volunteers here to develop the continuity of the project. So the figures are well known, don't want to spend too much time on this, but we will cover it in terms of the background about the importance and the impact of dementia. And what we are trying to do is provide a solution which will enable us to meet some of these challenges, dealing with some of these figures, and how we can contribute to the way in which it's dealt with, particularly in care homes. So we have detailed in our document, we'll be detailing the planned activities which can be used. This presentation will, I think, be posted anyway, so I don't want to run through them all, but it does detail in quite a bit of detail just how exactly we deliver our groups. There will be variations, and we're keen to hear on from anyone in any of the 4 nations just how many challenges or opportunities are appearing at the moment, so we can build that into the document, particularly with the last 2 areas here, intergenerational work involving schools. Because our education systems are slightly different, there will be nuances there that we need to build in, and also the need to bring in women's teams and players as well. So there's a whole range of activities. And as I said, geographical coverage is an issue, whether it's within a city or in rural areas, as we have a lot of challenges here in Scotland. We have a difference in demographic all over the country, and it's a real challenge to try and meet or develop our activities across all these different issues. So I'm going to hand over to Michael now. what we'd like to focus on this morning is where we are with our SWOT analysis of the strengths, weaknesses, opportunities, and threats. So I'll hand over to Michael now, and he can take us through a couple of slides detailing the strengths of where we are at the moment.
Okay, thank you, and good morning, everybody. Dementia's got a very high profile just now. Those of you who watched Breakfast TV would have seen the trailers for the programme about Jackie Charlton, and also last week in Parliament was a great study about the linkage between professional football and dementia. That's somebody else's fight, somebody else's battle. And the line we've always taken is, at the moment, there is no cure for dementia. So what we're trying to do is instill and improve care for those who are living with dementia. And the demands coming in for this kind of service are enormous. And people are very aware that while there's plenty of medication, tablets, and there is no cure, that supporting memory work and heritage-related work is as effective as anything else. So we've been doing this, I've been doing this since 2004, and nationally we've been looking at it since 2009. And by sort of dint of practice, we've come up with a model which we think could be applied to all the nations of the UK. And it's the support we've had from the professional sporting bodies has been tremendous. And we now have over 250 groups all across Scotland. And once people see how simple but how effective this is, they just definitely want to be involved. And while it's a kind of national hub of producing resources, the delivery can only be done at a local village town level. The missing link in the early days was a professional input from people who work in the history and the heritage field. And our early volunteers were all enthusiastic amateurs. And I don't mean that in a disparaging way, but they lacked the professional knowledge of conservation, preservation. And one of the big pluses, one of the big drivers that developed the project was the tie-up between the enthusiastic supporters and professionals in the heritage sector. But perhaps the most amazing impact I found was when we involved family members, young family members, and school children. We had a pilot project with a secondary school where they looked at people who were in their 5th and 6th year of secondary, and they had a very simple but effective introduction to what dementia was. And we expected quite a dropout rate after that. The dropout rate was 0. All the youngsters were keen to get involved with this. And when the young people mixed with the older people who were living with dementia, the older people just lit up and their self-esteem rocketed because they were able to tell the kids things that weren't in any of the textbooks. And as well as the sporting details, they were able to give them valuable insights into the social and economic and cultural history of their area. So I think that was one of the surprising successes of the project. So much so that after one session, a young lad held back at the end and he asked if he could talk to me. And he said, "I think my granddad has got this." And he was the first one in his family to twig that his granddad had a memory problem. And I thought that was quite moving. Okay, Hugh? The other strength we had was in the number of people who wanted to get involved with it. They were very keen to help apply their knowledge of the local club or the local sport to help these other people. The downside, which we'll maybe come on to later, was that sometimes people were applying to be volunteers maybe for personal reasons rather than altruistic reasons. The other strength we had was that we were able in the early days of the pilot scheme to have an initial research evaluation from a university, but it was good and it confirmed that what we had all suspected, that this was an effective way of helping people with dementia, but it ended up by saying, but it needs further research. So what we're really trying to get is to use the evidence in the groups to see what we're doing, what is effective, what we should do more of. And one of the regrets that I have is that we can't do this kind of activity every single day, because just to have sessions that are spaced out in the calendar, it isn't all that helpful. The impact we had early on was helped enormously by the media interest, especially from the sporting reporters, who were all very keen to connect this kind of medical breakthrough with an interest in the sport from the past. And that soon spread not only throughout the UK, but also abroad as well. Okay, Hugh? Well, I think most of these will come as no surprise to you, that trying to do this on a shoestring budget or a non-existent budget was very difficult. And the geography of the country told against us. So we had problems. The structural problems we had was that this didn't fit into any kind of political brief. It was partly medical, it was partly cultural and historical, and we didn't have one single point of contact. We relied on volunteers, and pre-COVID, most of our volunteers were of an older generation. And while they had a knowledge base of the sport and of their teams, we had no succession plan in place for when they were actually taken ill or whether they sadly passed away. The continuity was always a problem when you were only seeing people once a month. And that was the saddest thing, really, was when you left a care home and you could see the joy and the happiness on people's faces, and you knew deep inside yourself that you weren't going to see them for another month. People in social work who are referring people to us have massive pressures on their time, and they were covering a whole range of aspects of social care for the elderly, and I appreciated that. A major problem we had was in the staff turnover in care homes, that we relied on the success through what we called activities coordinators. And in the care homes, there was a huge turnover, poorly paid, and we would spend time training up the activities coordinator only to find that he or she had moved on within a matter of months. And regrettably, the resources that we put into the care home often went when that member of staff left. There was also a feeling in the care homes that a lot of the workforce didn't know, this is their words, didn't know anything about a particular sport. And we had to keep stressing to them that you didn't have to know anything about the sport, that the sports-related volunteers would provide that component. One of the problems we had was a lot of people who were fishing in the same pond, if you like, and one or two people had set up in local businesses who had just copied the whole idea, and they were going round and people were mixing up names and identities as to who was who. And one of the other problems we faced was this question of copyright issues. You can appreciate yourselves the use of still images in particular. Some of the fees that were being asked by the professional agencies were exorbitant, and they were beyond the reach of amateur groups. So one of the big weaknesses we had was in the early days not being able to have an agreement with a media organization who would give us access to the resources. We were not going to sell the resources we use, were purely for use in these therapeutic activities, but that didn't seem to cut any ice in the early days. Okay. There are massive opportunities in the post-COVID world for this kind of work. The demand is going to increase as the numbers of people who are diagnosed with memory problems and dementia increases. And I think the awareness of what was going on in care homes was massively increased during COVID. a lot of people who didn't have a family member or a loved one in a care home were probably unaware of what conditions were like and how stressed and stretched the staff were. And the notion of being able to see a family member through a glass window once a week was quite horrific. So that will present opportunities there. What we really need to get is the medical seal of approval to what we're doing, that this is effective. We have 1 or 2 GPs who are volunteers with us, and they are convinced that this is as effective as some tablets and medication. We need to get the support of the governing bodies for the sports, and because we all have separate organisations in the 4 nations, I think Sporting Heritage UK has a phenomenal chance here to pull this all together, because if you're using a resource, which is, say, a picture of a game between Scotland and Wales, Scotland or Ireland, Scotland and England, that resource has equal relevance in the other countries as well. The Hugh kind of flagged up this imminent change in the policy world, and it seems that in all parts of the UK, there is a strong drive towards a better integration of hospital service and care home services. And I think if we could present a UK link up in the application of sporting heritage, the moment might well be right for this government political level. We mentioned the need for research, which is relevant and not just a run through of reading lists followed up by we need more research. And we absolutely need, beyond all shadow of a doubt, to share our knowledge, share our expertise. And there is a clear and obvious way forward to link all the UK nations together. Because if somebody turns up in a care home way up in the north of Scotland, and they've moved there to be nearer their family, and their sporting interests relate, say, to Devon and Cornwall, we couldn't possibly go and develop resources on that kind of individual basis. But we could plug into a UK network and have that kind of material online for us. And the other opportunity, and this is one that's just kind of come into focus over the last couple of days, is talking to people who are working in the memories field, is that once COVID is over or is controlled, I think there'll still be a need for a kind of online provision, because some people who are unable to travel to physical groups will be able to access this material online. So as well as getting back to as near normal as we can, I think there's also a need to develop this kind of online memory work and access to heritage material. So that's not going to go away. Okay.
I'll deal with the threats here, Michael. Just to link between the opportunities and the threats there is a glimmer of hope for us, in the sense that a new project has started this month involving the University of Stirling and the University of Plymouth, which is going to take a cross-border approach to these things. It's a 3-year project, and they got 1.6 million to take that forward, and we're going to build in. They're doing it in partnership with Sports Heritage UK. So I think this is probably the first of hopefully a few heavyweight projects that would help us with our validation. And they're going to look at 20 care homes between Scotland and England. So that will give us a broad picture of how the challenges are being met. So the biggest threats we've identified so far are the obvious one, which we've been dealing with for the last 18 months or so, is COVID and/or something else similar. The lack of funding for staff support and resources. None of this will come as a surprise, but what we're offering is a model of support structure which would enable us to deliver at all 3 levels, whether it's local, national, or cross-border. There are different solutions for different situations that we are very aware of. Plus, there's the fluidity of the overall policy and political situations. We have structural weaknesses which are a major threat in that we don't have enough support or expertise, and particularly training programs which need to be developed. And Michael's point about retaining so much of our online work, we've had to learn very quickly how to deliver that, and some of the challenges. Everybody thought Zoom was a great answer to everything. Well, in this sector it's not, because it brings in its own difficulties about staffing and the allocation of resources to individuals as well as to institutions such as care homes. We've mentioned the changes in policy and provision. There is a major paper out just now in Scotland, which is going to I suppose, to summarise it, it would transfer the delivery of social care provision or home care provision from the private sector into the NHS and to integrate it fully. Now that will change things dramatically in terms of national provision, even in Scotland, because at the moment you can, within one particular town, have differing interpretations of governing policy delivered by different private companies. Copycat organisations are a threat to us in that all our delivery is free of charge at the moment. We have made no charges for delivery of our services to any care homes or anybody who wants to get them. We've been totally reliant on funding, and we know that some funding has been, if we can put it, almost intercepted by other organisations who are delivering the same thing but charging and running it as a business. And that is a serious issue for us, because government, for example, will not double fund what they perceive to be the same activity by different organisations. They will choose one set of delivery mechanisms and follow that. So in many senses, we believe that the integration of the service into the health service would help us in that respect, in that it would be easier to access government policy and government funding. The political changes, really, I really don't know what to say about this, because everything, it's happening on a daily basis in Scotland at the moment. Our whole system is tearing itself apart, it would appear, and we have an election looming. And depending on what happens with that, how government portfolios are divvied up, we'll be dealing with new sets of ministers, that's for sure. So there's a lot of new work to be done, but there is a long haul aspect to this, where the decision makers in the civil service are really the people we should be cultivating in many respects, rather than the frontline politicians who are transient by definition and only there for very short periods in some cases. The biggest threat of all we have had to meet is overwhelming demand for our resources and our services, just how we can cope. And we do believe that we need to have a proper structure in place across the UK to help us deliver, albeit with local solutions within the four nations. But we do need a framework which would enable us to look for more funding and have a better chance for funding, but also to deliver the service in a better and more efficient way, because we are cost effective in what we do. We need more proof of that for sure. So that's a threat as well. But the overwhelming demand is a very serious issue. So we're conscious we will have a couple of caveats in the report, obviously, which we've touched on before, which is that there are differences within the UK and Scotland, England, Northern Ireland and Wales, where differences in government policy, government attitudes and all the rest of it. So we'll try as best we can. We'd appreciate some feedback today on some of that, in maybe in terms of what we've said doesn't apply where you're sitting. That's fine. We just need to know a little bit about that so we can accommodate these differences. So this is the kind of structure Michael and I have developed. It's not rocket science by any manner of means, and I don't think it'll come as a surprise, but we're looking at it in the UK context, but also within the four different nations. That if we start at the bottom up, in terms of individual sports, our view is, and it's worked very successfully in Scotland, is that we need a lead volunteer for each sport and also an ambassador. Now, the difference between the two is one is more practical. The lead volunteer would be more hands-on, if you want, whereas the ambassador could be more than one, obviously, would be high profile, credible, an advocate or a champion to do some of the political stuff and the glad handing that is necessary. But the lead volunteer is key in that that person would be driving the practicalities of it. And each of these sports, we reckon, should have, and it's a model we've developed with constitutions and all the other paraphernalia, of a steering group which would manage that and would help with the continuity, because as people move on, it's important that that continuity is established from all these different sectors, whether they're ex-players, bodies like Alzheimer, UK or Scotland, and then the medical sector as well. So at country level, the 4 different countries of the UK, we reckon we need at least one national development officer who would be a staff member to coordinate all these activities, to work with the other. If we look below that, within the national structure, we'd have 4 national development officers, at least, I think we should be saying there, for each of the countries working together within the overall organisation. And that would give us a much more strategic approach to fundraising and service delivery. So that's the broad outline. It's a very simple structure, and it works from the bottom up, reporting into the overall organisation. So in summary, there's no single way to run these sessions or the activities. Membership will vary across the nations, within the nations, and within local groups as well, but we should try to have basic minimums. There are some legal issues which will define that, whether they're declarations of convictions and all these things that are part of this, because if you're involved with vulnerable people, there are differences in the way that's managed as well. Routines, methodology and formats would be established within the UK policy paper, and the development should, if we have a UK-wide network, we should be in a better position to exchange information, use and adapt our resources, as well as new knowledge, transfer knowledge in a much more efficient way, and provide just a bigger and stronger sense of belonging to a much stronger resource. So that's basically the summary. The caveat is, of course, that there are nuances which we'll try and take on board, but we'd also like to be kept appraised of any changes or anything that's glaringly obvious in what we have said or what we haven't said. So we're open to discussion on all of that. A couple of contacts for Michael and myself, which we can leave there, but they will be posted in the presentation as well. So I think we can leave that there just now, Fran, if that's okay, and open the meeting up for discussion on some of these strengths, weaknesses, opportunities, threats, or anything else people have to bring up.
Lovely. Well, what I'll do is I'll pop the email addresses in the chat, so you could stop the screen share so that we can all see each other, and that will hopefully bring us all back together. There we are. So where would you like to start with the discussion, Hugh?
Well, I think if there, I suppose the obvious question is there anything we've got wrong or anything we're missing at the moment? Is there any clear suggestion that anyone has that would add to what we're planning or proposing at the moment?
Joanna, did you want to say something?
Oh, hello. Excuse me while I came in halfway through the presentation from
You're just on mute at the moment, Joanna. Do you want to unmute yourself?
Excuse me. Hello, everyone. I've joined halfway through when I think Michael was doing his presentation, so I might have missed something. And excuse me if I ask the speakers to repeat themselves. So it was something to do with what you said about copycat, Hugh, that really just had a warning sign in my head. So my work at the Tottenham Hospital Foundation, we do work with care homes, and we don't charge for any of our memory work. And our memory work method is pretty much adopted from the Sporting Memories Foundation, which I know you guys all know. Now, those who are involved with the Sporting Memories Foundation with their sporting memory sessions, I know that they are pretty much either run on a volunteer basis or they are funded through other funders. Where you said about the copycats and charging, I'm just wondering how do you
Sorry, Joanna, we've lost you.
communicate with the care home to share who they themselves are, the activity? Oh, sorry, my internet connection is unstable. It says unstable. I hope you can hear me.
Yes.
My internet connection is unstable. I hope you can hear me.
Yeah.
Yes, we can. Yeah. Do continue.
Yes. So
I think we've got that, Joanna. I think if I understand you correctly, I mean, it is a situation we're aware of. There are different elements to this in that one of the challenges we have is that other organizations anyone can set themselves up and do this. But the difficulty for us, and we've found in Scotland where other organizations have been doing it, and let's say, for example, it doesn't work, and a certain area, provision in a certain geographical area falls apart because something's not working, and that group then moves on. We have often found ourselves in the situation where we're left picking up the pieces, if you want to put it that way, and having to try and resolve matters. Now, I mentioned earlier that in Scotland, there was one big bundle of funding was allocated to one service provider. And because of that, the government then won't refund. And the National Lottery takes a similar view. You're working in an area that has been funded already. They tend not to be that keen to put more funding in because they'll say, we've done that, and they let it go. So the challenge, I think, for us is to establish our credentials in a much stronger way. It's about media profiling. It's about having a communication strategy which tells people who we are and what we do, how we do it, and how we're funded. We don't, for example, our organisation, certainly in Scotland, hitherto, has not been funding staff superstructures which are soaking up a lot of the resources. Bluntly, when funding is allocated, our view is that the funding should be allocated to the delivery of the service, the resources and the training and all the rest of it, not to staffing, although you do have to have some staff. I don't know if there's anything you want to add to that, Michael?
Yeah, the other element that we've identified is that there are actually some individuals who have set up as a private business, going round to care homes and selling their services. And the other one that is a strange one is that sometimes a national organization tries to apply for funding to find that a single club has already taken up a major chunk of that funding. For example, in the early days, there was one particular football club had a massive amount of funding. And then when the national project tried to apply for funding, they were turned down because they'd already funded a similar body.
So do you think going forward, it's a case of, like you say, it's communications and everybody sort of working together? I know the ethos of sporting heritage as a whole, for coming from a training point of view, and I think this cuts across the memory work, and do say if you think I've got this wrong, Michael or Hugh, is that we very much want to train and support you guys to do the delivery, or your volunteers, or who you're working with. We don't particularly come in and do the delivery ourselves unless we're particularly commissioned to. So we're all about supporting and empowering the network as a whole. And I think that will continue to be our ethos. I mean, that's what underpins our training at the moment. So maybe it's for us to communicate that if you're looking to go for funding for this area of work, do come and talk to us in case it's something we can apply for together to make a stronger partnership. And then we're not competing over the same sort of pots of funding, because everybody knows the competition for funding is getting fiercer and fiercer, and this is an area of work that people are all really interested in, and you know, we would happily, I think, speaking on behalf of Justine, we're happy to partner with people or support a bid if it's you know, this is an area of work you're wanting to go for. So I suppose it's keeping those channels of communication clear.
Yeah,
I think as well, just to add to Joanna's point, that, you know, the model that Stirling have created just now with the University of Plymouth, the universities are really powerful in terms of providing the validation for the activities. What we need is for local groups to identify where they need help, whether that is physical resources, online resources, or whatever. And to, you know, rather than spend so much time, we've found ourselves chasing funding so much that it detracts you from the actual activity. The core activity of what the groups are supposed to be and trying to do is soaked up with another lottery fund application or whatever. If we can take the pressure off the groups into the network, if you want, through these officers or what project managers or whatever we want to call them, I think that would enable groups to be much more productive and cost effective in terms of what they're doing on the ground.
Chris, you wanted to say something?
Yeah, just Chris Chatton, Yorkshire Cricket Foundation. I've done some good work with Fran on our projects locally as regards education. But in terms of reminiscence, I really agree what Hugh and Michael are saying, and the idea around copycatting, and that could be an issue. And for me, it's where the balance of any external funding sits. And I think, like Fran and Hugh and Michael said, the focus has got to be on paying for training, upskilling volunteers, upskilling staff in community sports foundations like myself and some of the other football and rugby foundations that are on this Zoom today. But I think there's a danger, like we've said, as regards funding, lots of organisations going off and sourcing lottery funding or other to deliver their projects and getting it. And then there might be other projects in that locality that don't get it because funding's tight. So I agree with the structure that Hugh and Michael have developed, and maybe some funding officers sat with sporting heritage to support a wider network, whatever that looks like in the future. But what's the collective thoughts regards what's happened below that and where the balance of funding should sit to take this on, really, because it's a huge animal, isn't it? It's going to grow and grow.
Michael.
Yeah, I would agree with that comment there from Chris. I think the sporting foundation level, club level, is one of the best things that's ever happened, because the people involved at that kind of grassroots club level, they know the sport, they know the club inside out, they know the social history of the area. That's the most exciting level at which this whole project can take off. And what really used to annoy me was when you saw a lack of altruism from, well, it was almost like a free-for-all, where a fund comes up and everybody dives in to try and get the money, and it kind of clears the pitch for everybody else. I mean, that example I gave you about the football club, this one club got an amount of money that was twice that we would have applied for as a national project, and they got it. So I think that grassroots level, club level is the way to go. And the number of clubs, rugby clubs who are doing this, and a kind of a domino effect. I forget the girl, is it Alison in rugby league? The amount of interest that's created at club level is phenomenal, and I'm sure that could be replicated in every sport. So that would be the basic building brick to develop at a local club level.
Joanna, would you like to come in again? Sorry, Hugh.
No, it's okay.
Sorry, Hugh. Yeah, I just want to kind of reflect on what Michael said. I remember I was in a discussion with funders and giving funders feedback on their funding eligibility structure, and it makes me realise that some of the funders, they hadn't considered the capacity issue amongst some of the smaller clubs, or well, actually most of the time it's smaller clubs who are focused on the grassroots and doesn't have that kind kind of the capacity to manage the funding applications and so on. I almost think there must be in some feedback session that we can feedback to the funders. I know I recently did it for Heritage, the lottery fund, and they actually send out a survey. So for those of you who haven't received it, I would encourage you to go onto the survey. I'm not sure if it's still on or not. They did reach out to all of the existing partners, like myself, to feedback to them how can they make the next funding more accessible. But it's funny though, isn't it, because they only contacted people that was on the program. So what about smaller clubs that was never been on the database? So already how can they get feedback on how to make the funding more accessible for clubs who are not on their database? So I actually set that on my feedback anyway. So I'm encouraging you all, if you haven't, if you're not on the database, please do. So we need to give the big organisation with the funding, like the lottery fund, to say you need to ring fence a amount and care for those who don't have that capacity, and acknowledge that we don't have that capacity. Although myself is coming from Spurs, but you know, people see it as a big thing, but it isn't. It's the foundation. We work in the foundation, and we don't have a capacity as a football club, which is the corporate international business. We're not, you know. So just want to feed that back to everybody. Thank you.
Yeah,
Lovely,
I think that's a really important point, and I think if we can, we're always saying in a way that we need to divorce the funding and the advocacy away from the activity, you know, and have specialists, funding specialists, who will engage with these lottery groups, as Joanna said, you know, at the level where they're making policy decisions on who is and who isn't eligible for the funding. We've had that. If you're not a charitable organisation in Scotland, you're automatically excluded from a lot of the funds. And that, at the moment, it takes 4 months to get that status. So the whole thing, there's a whole structural thing that's really slowing us down at the moment.
I mean, from a sporting heritage point of view, we have very good links with people, with the major funders, including Heritage Fund. And I know that Justine has spent many years advocating on behalf of sporting collections and sporting activity, so that they can really see the impact and value of our collections. And I think that's been reflected in the funding that we've had recently. But as always, there is more work to be done. We've got lots of hands up at the moment. Henry, if I come to you first, and then I'll come to you, Jason.
Yeah, thanks. Henry Ridden. I'm a photographer and arts practitioner. I've done various community arts projects and the like, and something that I'm interested in developing. A couple of points, really. I think one, if you've got organisations, you know, if the funding's in place with regards to delivery of projects, then you can bring in a broader diversity of people to deliver that. Because obviously, if you're delivering a workshop during the day, then, you know, a lot of people may well be at work or whatever. Whereas if delivering community arts projects is your work and you can be funded, then you can deliver it. So I think, you know, paying people to deliver this sort of project, I think isn't, you know, can be a good thing, because you broaden out the skill set of the people that you can attract. And also from a funding perspective, obviously I work within the arts primarily. And, you know, depending on what element of memories that you may be working with people, be it still images or moving images, well then, you know, or written memory, literacy, photography and literacy is something that I'm developing at the moment, then you're working with the arts. So you're working with people and the arts. So funding need not necessarily come from a heritage organisation. If you're delivering several workshops in a town or whatever, or in one or two care homes or whatever, there's no reason I wouldn't see whereas that couldn't be Arts Council funded, because you're working with visual arts or written word or poetry or whatever. I'll put a link in the thread, in the chat thread, to a project I was involved with in Lytham St Anne's in Lancashire. It wasn't specifically a sporting dementia project. It was a general dementia project with a Blackpool and Fylde Hospitals Trust, where young people went in, spoke to the dementia patients, their memories, some of which were sporting. There's a guy who was into motor racing, and that was then developed with a dance organisation into a theatrical dance piece, which was presented outside in Lytham, on the green, and also in the town centre. So working with the people's memories, it benefited them as individuals, but it was then performed twice in the town, and also a big festival, a Lytham festival, on the stage, and that was arts funded. So
but I agree, Henry, that is a really important point, because one of our biggest challenges in Scotland is that the creative sector, I mean, we have an outfit called Creative Scotland, which is the equivalent of your Arts England, will not fund any of our activities because they don't see that crossover of creativity and imagination and all the rest of it. So in that sense, you're miles ahead of what we've got. And these are local issues that can be managed, you know, depending on festivals and all the rest of it.
I think it's the way it's framed. So if an artist applied for the funding, not you, then they could frame it in an artistic way and sort of go by the back door.
I don't think
it's about the collaboration.
And I don't think we would ever discount paid delivery for particular activity, because that suits particular activities. Sorry, I've not expressed that very well, but you know, sort of slightly horses for courses. Some, if it's proper community arts work, then yes, it would be great to bring in a practitioner and support them. And as you say, that's the sort of thing that Arts Council England and its sort of equivalents in the other home nations would definitely support, because you're linking with the arts and supporting a practitioner at the same time. And I know that we've got other practitioners in the room. So I think it's just trying to look at what's the right method of delivery depending on what level you're at, whether you're at club level. Sporting Heritage is doing quite a lot of work at the moment on another project with the national governing bodies of sport, trying to do advocacy at that level, and then working out what might be the most appropriate way for them to sort of deliver activity or support the delivery of activity. So it's trying to work out how it all sort of jigsaws together, I think. Jason, you've been very patient. Do you want to go next?
Yeah, just a bit of feedback, really. I suppose I'm quite fortunate in the sense in that I've had an engagement with, I'm going to say their name, Sporting Memories, for about 8 years now, because they actually started to pilot some work in North Yorkshire, where I was working for the public health team at that point. So I was interested in that concept, and then ironically I ended up then working for them. It was one of my next roles, and now I'm at a football club where we have our own reminiscence activities, but we don't necessarily work with Sporting Memory. So I've seen the evolution of that charity, and I've seen that from various different angles. And I think my comment to you, my thoughts really are that what you're trying to do, I can see why you're trying to do it, but I think from our perspective, and I'm saying that as someone who's in the third sector and maybe working at a football club as well, is that it would be very confusing, because what I'm seeing is what's been done, and it's been done quite effectively as well. And I think from a political perspective as well, they have great support as well, and there will be other agencies as well, because you're absolutely right. It's one of those difficult products, really, which is really hard to kind of own. It's essentially talking, and so there's obviously a lot more to it. And I think what I can reflect upon in my time having worked in that area specifically is just how complex and how layered it is. And so I had a remit for a county, and even then it was too big. So if you're thinking about national kind of focuses, I think that even is too broad. So I just I'm not saying it's not doable, but I think you've got a big challenge on your hands because of the current landscape. Certainly from the view that I'm in, which is working in football, working in sport, I know that there are some very well placed agencies, and I've mentioned one, who are doing that. So it was just a bit of thought, really, just from someone who's kind of, would potentially be a kind of a potential prospective partner for you, is that I think it's, I think it's confusing. I'll be honest with you, but that's not to say that you can't do it, and that can't be further clarified. But I think it's a really big challenge for you. But I genuinely wish you well on that.
Hugh, is there anything you'd like to pick up on there?
Yeah, can I just ask Jason, how did Blackpool become involved, as an entity? I mean, was it just a local approach, or
as a foundation, or as in terms of the sporting memory stuff?
Well, your own. Do you have a position with Blackpool, or are you in their superstructure somehow? So
so you'll be aware that most professional football clubs and professional sports clubs, like we've got Yorkshire Cricket Foundation as well, have got a foundation element to it. So I work at the foundation,
okay.
and I'm head of community programs here.
Yeah. Okay.
Now, there's something that Anita put in the chat about training. Do you want to just talk about training and delivery? And then, possibly different models of rolling that out, Anita.
I was just interesting from a different point of view, because I wear many hats, and I'm freelance in all sorts of directions. And I was interested in you were saying about people going out and charging for their services and that sort of thing, and different companies competing. So how can we get involved in your organization? How can we kind of join together? So for example, I offer training workshops in oral history and reminiscence, actually, but I offer those as a business. But in terms of being involved in a project, I have to earn, I have to eat. And so it's quite difficult when everybody is asking for volunteers. But I just wondered how we can access the training, for example, and maybe there's an opportunity for people to be delivering training to volunteers. I just wondered how you sort of square that circle.
Well, I think the simple answer to that, and bearing in mind what Jason said, it's a complex issue, but the answer is yes. I mean, the volunteers can't do everything, and there is a professional level of delivery which is required, and that is quite broad across different sectors, and that's where when you say our organisation is Sporting Heritage UK. I mean, it's not Michael White and I doing something on our own behalf. I mean, we are part of Scotland's arm. I'm a non-executive director of Sporting Heritage UK, so I'm not working for anyone else in that regard. So it's for Sporting Heritage UK. That's why we're doing this document, so that the UK organisation will have a better handle on how they can support and commission people to deliver. We're not saying nobody should be paid for this at all. That's, if it's coming across, we all have to eat occasionally. But that's not our aim or mission, to stop people being paid to do this. On the contrary, what we need to do is to have the right people paid to deliver the right things in the right areas. But we feel that it's so fragmented at the moment, and the access to the funding is so difficult, that we need to have some sort of structure to it.
And if I might just jump in just quickly from a training program point of view, something that most of you won't be aware of within Sporting Heritage, because you've seen that the Sporting Heritage activity has just exploded over the last year. So we've really grown as an organisation, and as a result, we're in the process of putting lots of sort of strategies in place about how we can continue a lot of the work that we're doing. A lot of it is grant funded at the moment, and obviously, grant funding is never guaranteed. And I'm obviously particularly looking at the training programme, and something that Justine and I have talked about for quite a long time is putting together a set of core modules that we would deliver year on year for those sort of really basic, and I mean basic as in more that sort of core sense of the word, skills that are useful to everybody, and whether that's something, and this is what we're still bottoming out, and this is probably a conversation we need to have with you, Anita, and with other practitioners who work in the area, is whether we commission you to come in each year and deliver a slightly different session, particularly, I mean, just taking on board what Michael and Hugh have been saying about the delivery of memories work is going to change quite dramatically as we come out of COVID, and then we might end up with this sort of parallel online and in-person delivery, and what might that look like? Or do we, so we might commission you to come in year on year to do it, or do we commission you once to do a recorded session that sits in our library, sits on our YouTube channel, that people can maybe have as an introduction, and then we run sessions that are more like this, that could be a facilitated session where people talk through the individual nuances of their situation, because I think one core session is never going to cover everybody's needs. So we're trying to work out as an overall organisation, and it's across all different areas of work, not just memories, how that might work. And I think probably, as with all things, we need to come out and talk to the network a little bit more. But obviously we're very keen to support those like yourself who've got the skills and the links with the sporting collection. So it's trying to work out that balance. So I think I'm saying we're thinking about it, but we haven't got the answer yet. I'll let you know when we do. Michael, Anita, did you want to come back on that?
Yeah, just really, I was just wanted to follow up on what Jason was saying about the Sporting Memories Network, is that they have such a high profile, and they seem to be the sort of name people have heard of, and lots of people are applying for funding, I think, in and amongst that network. And it's, I think Hugh or Michael was sort of saying how to raise the profile of this, which is a very different way of looking at the well, it's not the commercial aspect, which I think is becoming more and more of a priority for some of the other networks, and it's how we get that across, how we get that profile across. And that, I mean, there's TV programs, aren't there, now based on sporting memory networks, and it seems to be the name people have heard of. So I just wanted to throw that in there.
Yeah, well, that's just a fact. Yeah,
just Jason rightly said that we face a tremendous challenge, but that structure that we proposed there wasn't plucked out of thin air. That's the structure that actually does exist. And in Scotland, all of the football clubs, the people who are involved in the memory work, they meet together on a localized basis. So there is a coordination, there's a representation, and the national steering group includes people who are actually deliverers of the projects. So that's how the decisions that are taken there, they're not just theoretical, they're actually coming from people in the field.
Right, so we've got two people with their hands up. Chris, if I come to you first, and then Jason, I'll come back to you.
Yeah, thanks, Fran. Yeah, just picking up on a few of those points. As part of our National Lottery Heritage funded project, obviously reminiscence was a key part of our outcomes, and we did some work on the early pilot with the Sporting Memories Network, which Jason mentioned, and we did some work in the early stage of our delivery project. But there is a charge for that license or that product. And if we were to roll it out across cricket clubs, that could be significant over time, like an annual charge. And I know there's some really good work there, and the model's quite specific. But obviously, what we're talking about here is different modes of delivery and reminiscence, because there's not one way to deliver reminiscence. There's lots of different ways that can be done. So I guess we went down a different route, and the model that seems to work from my perspective, from my limited experience, maybe in comparison to everyone else on the call, is that if we can do something at a foundation level that's relevant to the communities that the foundation work with, and we can get some bespoke advice, guidance from Sporting Heritage, Hugh, and any training that goes out there to upskill people like myself and some of the volunteers, that's probably a more sustainable route to develop these groups from my limited experience.
I think that will be true for lots of clubs, but that's not to say that the two models of delivery can't work alongside each other. I know from Sporting Heritage's point of view, the work that Michael and Hugh have been doing is obviously all part of this profile raising. So we'll have our handbook toolkit very soon. There'll be this UK-wide approach. We're always busy developing case studies so that we can showcase the type of work that's been going on. So if you are involved in a project where you've had Sporting Heritage support, we would always be interested to hear from you to talk about developing that case study, and then hopefully over time that's going to build, you know, a really good quality mark for the sort of work and approach that we're taking. But as I say, that's no reason why other models of delivery can't, you know, coexist with us. Jason, you wanted to come back in?
No, it's nothing really. I think it was just more of a. I'm just conscious of, before I sort of find myself sort of becoming a, you know, the spokesperson for Sporting Memories, which is definitely not the case. You know, as I say, we have a Sporting Memories session, but it's not a partnership that we have with Sporting Memories. That's not to say that we wouldn't look at that in the future, particularly as I know how they're evolving as an organisation, where they see their sweet spot. I think it's just to sort of, I mean, I think I can see how there might be. All I would say is if you're going to go down this route, you know, at some point you would hope that you would also have that platform that the likes of Sporting Memories has too, because as the product grows, so you need to then obviously generate more income to then, you know, sustain and develop and grow that, and as your learning grows, and that obviously goes. So I think, you know, just because they are you know, politically quite powerful now and have got a high profile, I think that, you know, that is something that you as a network should probably be aspiring to as well. So I just, you know, I'm interested in potentially, we've looked at heritage as a route that we want to go down as a football club. It's an area where we ourselves here in Blackpool, we've had some difficulties over the recent years with a relationship between the football club and the community, and that's well behind us now, and it's a really it's an amazing place where we're in. So the time is right for us to really look at that bigger heritage piece, and I think that the partners that are connected to your network make sensible partners, and that would be an interesting route. And it was interesting to see the previous consultation or community, the engagement event you had, which Justine facilitated, because there was a number of good practice there that I think we would be keen to kind of work with. So this network has clearly got some value, but I think that also, you know, Sporting Memories as an entity and as a product, which is, you know, very much incorporates physical activity as well, is one that is of significant interest for us too. So it's just, you know, you need to be able to clarify and clearly state that, don't you? So you need a platform to articulate that, and that's what Sporting Memories have got and what you would aspire to as well, I think. So I'm gonna have to go in about 6 minutes as well, so I'm not being rude as well, but it's been a really interesting conversation.
Good.
I think very briefly, Fran, that's a given, Jason, and you know, you will notice that our presentation was not called Sporting Memories, it was the application of Sporting Heritage. So, you know.
Yeah, Fran, could I just say, when we delivered our heritage project to Huddersfield, which we got decent funding for and lasted for 3 years, we found great crossover between Sporting Memories and oral history, which I think is probably a given. But then both of those aspects then fed into all sorts of other areas of the project, such as the physical and oral archive, exhibitions, education packages, books, trails, events, presentations, and it was all interlinked. It wasn't one disparate, one separate, isolated activity. And we found that was very effective, linking it into other areas and then bringing some of the dementia groups to the presentations and to the exhibition, and seeing how what they told us fed into the rest of the project. And I think that added value and made them feel more valued as well.
Yeah, no, that's a very rich resource. I think that picks up on the comment that Anita's just put in the chat about working with schools and that sort of intergenerational aspect, and what Henry was talking about earlier about reminiscence and working with arts practitioners and other visual art forms. Michael, you wanted to...
Yeah, I think it was why I personally think Sporting Heritage UK is the home for all of this is because it's a two-way process, that as well as applying heritage to help people in all kinds of areas, there's also a spin-off in the people we're working with, they are contributing to the Sporting Heritage knowledge of the club, the area, the country. And we've unearthed stories that nobody had heard of, and we fed that back into the appropriate heritage locations. And the other one, just picking up on that last comment, absolutely 100% agree that I've been at sessions where you've gone in with a focus on a specific sport, let's say football, and football was hardly mentioned because somebody made a comment early on that triggered off memories of the war, of national service, of sweet rationing, of factories, pubs that were no longer there. It really is, it's the trigger, or it's the key to open a box of all kinds of memories, and also to reinvigorate lost skills. Picking up on Henry's point, we had an old lady in one of the groups who hadn't done any what was Pitman shorthand, and this triggered in the group. She dictated a letter, I dictated a letter to Alec Ferguson, and she did it in Pitman script. Another guy who hadn't sketched for 30 years started doing pencil sketches of iconic players. So it's a massive opportunity, and that's why I think heritage is a location for it.
And I think that's one of the unique strengths of Sporting Heritage as an overall network, because we're not only working in the memory area, we've got people who are involved in collections and exhibitions and learning, and like pick up on what Michael was saying, you can share that information so that it's making that sort of overall richer record of Sporting Heritage. Henry, you wanted to come back in? Oh,
I was just going to add that from a sort of personal perspective, I think it's interesting that Michael and Hugh and yourselves are working with various universities on it, on the whole approach to it. Personally, I think that gives the whole thing an element of gravitas. So well done, you. No, but you know what I mean. I think if you're talking to potential funders or potential partners, if you've got some sort of academic kind of background to whatever you're doing, it certainly helps.
Hugh, do you want to talk a little bit about Sterling and Raf at Bournemouth?
Yeah, I mean, you're absolutely right. It's all to do with the credibility and the validation. And if you're going to funders, they want to know that previous funding or previous projects were successful, and if so, why? And it's just the reality of it is that universities are some of the biggest rubber stampers that you can get, and we're very fortunate that Sterling has a big gerontology unit, and they are specialists in dementia and delivery of projects and so on. So they're a very good fit, and what really is encouraging here is the cross-border element. It's not just University of Stirling doing it, they're doing it with Plymouth. So it kind of broadens the base. And when you go to people like the Lottery Fund and so on, if you say that, for example, the handbook, Stirling University are looking through that and advising us on the contents and the layout and all the rest of it. It's just they are experts in their field. And I think if you can latch on to a local university or set of experts, but the universities are the ones, and they have access to different funding. It's not lottery funding. I mean, this Sterling one is 1.6 million over 3 years. Now, I mean, it must have taken a bit of doing to pull that application together. It's way beyond our pay grades. But when it happens, the important thing is to be in on it, and Sporting Heritage UK are partners in this project. I mean, that's a pretty hefty bit of gear. And once it's done, or as it's being done, I think we should make the most of it and see where it takes us. They will open doors to us that are not open to mere mortals, not in universities.
Yeah, just as an aside, I was
to anyone around the table who's in a university at the moment.
As an aside, I was working I work commercially photographer as well. I was working at University of East Anglia in Norwich last week, and a lot of the key research on dementia through heading footballs is being done at the University of East Anglia. So you know, they're not involved from an memory point of view, but a lot of the research on the causes of dementia through sport is being done at the University of East Anglia.
Yeah.
Well, we're almost in our last 10 minutes. Hugh and Michael, is there anything else, any other areas you wanted or would like feedback on that we could open up for discussion in our last few minutes? Or is there anything else anybody within the cohort would like to discuss that sort of touches on your work or how you might deliver?
There's been a lot of really useful stuff in the chat, which we'll go through, a lot of good links there. So if anyone's got good examples or examples of good practice, they're particularly helpful, that we can use them to give us a bit more credibility and linkages.
Yes, the only one I was going to add was a real concrete example and almost an immediate one. I've spoken to Chris about this before. We struggle in Scotland, obviously with the weather, to really get cricket memories off the ground. And a link into the Yorkshire Cricket Foundation would be absolutely brilliant.
Great, Michael. Thanks for that. And we really need to pick that up, don't we, and have a conversation maybe offline about that, because I think there's a lot of work we could do cricket-wise, spreading across the country, working across other counties, Scotland. Yeah. We do have a chap from Scotland actually who comes to our.
Yeah, we know him.
He really enjoys them. He emails me quite often saying. So happy to work with Neil and you to try and sort something out up there.
Yeah, good.
Feel free to use the link I posted about the Dementia Arts and Dance Project. If you need to share that with whoever you want, that's fine. It just sits on my my Vimeo. And there, like I say, there is a motor racing anecdote within it.
Yeah,
lovely.
It takes it out of the box. You see, that's it's just there's an example of what can be done if you think that way.
Yeah.
So I was just going to say, I just wonder if the whole social prescribing movement that's happening at the moment, whether funding could come through that way. So reminiscent sessions and dementia groups through local GP practices and that sort of thing, as well as sports groups. So it's just another way in. And the same, on hospital wards. I mean, I have personal experience of my mum being on a ward, not anymore, but last year, and there was nothing for them to do. Nothing.
The Youth Arts Dance Project took place in the hospital. The anecdotes were recorded, and there was some. All the work was done out of the hospital with the dementia patients. Yeah. Obviously, the dance was with the young people was done elsewhere, but all the reminiscences was done within the hospital.
Yeah, and it's such a valuable thing, because people stuck in hospital, geriatric wards or whatever, they just don't have that mental activity going on, and it's difficult for people just to be on a ward and not do anything.
Definitely.
We've had a couple of clubs, just to finish off briefly, a couple of clubs have successfully built in relationships with their GPs, for example, if they're doing a building project for a new clubhouse and facilities, that they've gone to the local GP practice and said, look, would you hold your surgeries in here? It ticks a huge box for the lottery fund if a GP is involved, and then the GP can actually almost prescribe, look at all this stuff on the walls and whatever. They become part of the process then, and it's much more real, and it's just a really good solid link that works both ways. So that was one way of doing it, and it was successful with a couple of lottery funding applications that it ticked a really big box.
And there has been so far one example of funding that's come out, and it came out from Arts Council England earlier this year, where they were particularly targeting projects that included social prescribing. And it's something I looked at for another client of mine, and it was quite a tight brief, because we were looking at it from a museum point of view. So you needed a social prescriber, a community group, a museum or similar sort of arts organisation. And possibly a school. There were quite a lot of boxes in comparison to normal grant funding. There was quite a lot of boxes you needed to tick. We were in a position to tick all of those. The thing that we couldn't do for this particular round of funding, and I'm not entirely sure why they'd gone down this route, is they were looking for 20% match funding for the bid, and it was for bids up to about £25,000. So that was quite a lot of match, particularly coming out of a COVID pandemic, for somebody to find. And we knew that the partners that we wanted to work with, I had my museum hat on, but even when we had informal discussions with the social prescribers, they weren't in a position to be able to contribute, even if we'd gone to everybody and asked everybody to put a little bit of money in to find the match. So that's what was the barrier for us, and I'm sure that would have been similar for all other organisations. But having said that, I think it was very encouraging that it was an explicit fund of money that linked arts and heritage with social prescribing. So I'm hoping that it will be there'll be more coming that way. I'm not sure they've announced who actually got the money for it. I don't know when it closed, but it'd be quite interesting to look at the projects that came out of that funding.
There is also, Arts Council also do a programme called Developing Your Creative Practice.
Yes.
So if artists wanted to develop work around this area, then I see no reason why they couldn't apply for the Developing Your Creative Practice to develop oral histories, memories based about art or art creation through dementia. I mean, that would be down to the artist to develop, but they could get funding to trial, say, 5 sessions within a rest home or whatever, and then then they've got a package of evidence work that can go forward.
Yes, I think that there are several rounds of that Developing Your Creative Practice coming out from Arts Council England, if you're in England. So if it's something you think that might be appropriate for either for you or a practitioner or group of artists that you might work with, it might be worth looking at it.
Yeah, I've been looking to develop something with schools, but this conversation has made me wonder that I could maybe build in some schools, maybe build something like this into what I'm thinking possibly.
Well, I know that when you've done that, Anita, you said it's been very rewarding doing that intergenerational aspect with schools and memories. So, Michael.
Yeah, just before we finish, the biggest impact of Memories work is in providing relief for carers, and there would be a huge advantage in linking in with the various national carers organisations, because the feedback we get from the carers is that this is the only time they know the person they care for is safe, is relaxed, is happy, and it gives them a moment when they can, as they say, be themselves. So we shouldn't lose sight of that one.
Well, we're now in our final minutes. So Hugh and Michael, would you like to make any closing remarks and anything else you would like feedback on afterwards?
No, just to thank everybody for their contributions. It's been very useful, quite revealing, and comforting to know that there are so many challenges out there that people are facing that are very familiar. It's just trying to get a handle across. It's complex, it's a big challenge, but that doesn't mean to say we shouldn't pursue it with all gusto. So we are doing that. So we're open to any suggestions or hints. There's a whole heap of stuff I'll need to go through in the chat there that's particularly that interesting link there about the thriving communities.
Yes, I think Joanna might have found the link for the fund that I was talking about. I can't check the link while I'm in the session, unfortunately. But
yeah, I've just saved it. So it's very useful to have that kind of reference. So anything else like that, it's grist to the mill. And we're hopefully going to turn this round by the end of the month. That's our target. So we may put bits of it out and ask for further comments, but we're open to any suggestions or hints or criticisms, anything. Fire it this way.
Lovely. Michael, any closing remarks?
just again, thank everybody. I think now is the moment to develop a UK-wide strategy. The competition for funding post-COVID is going to be absolutely massive. And if you can come forward with a UK proposal for a UK development, then I think we've got a far better chance of success.
Definitely. Well, I'll bring the session to a close there. So thank you everybody for your time this morning and for all your contributions. As always, I will share the slide deck from Michael and Hugh. And once I've had a chance to edit this recording, I will share the link to the recording as well. So that will come round in the next sort of week to 10 days. That will include I'll put in the links that have been saved in the chat as well, and I'll make sure that Michael and Hugh's contact details are in there. And as they say, coming soon will be the toolkit handbook and more information about the UK-wide strategy. So thank you very much and goodbye.